Welcome to UAPB Meet the Researchers and Grant Writers. This program is designed to let the public know about the great research and grant opportunities that are available at the University of Arkansas at Pine Bluff. So today it is my delight to have with me Dr. Marian Evans-Lee, who has been with us for a few years, and she's doing a great job with a program that is entitled the Minority Initiative Sub-Recipient Grant Office. And we're going to start by just introducing her, and I want her to talk about what she does and especially to identify her funding agencies. So welcome, Dr. Evans-Lee.
Thank you.
Tell us a little about yourself. When did you come to the University of Arkansas at Pine Bluff?
Okay. I came to the University of Arkansas at Pine Bluff in 2006, and it will be 10 years this October.
A decade.
A decade.
Okay.
And I'm the program coordinator for the Minority Initiative Sub-Recipient Grant Office here at the university. And we provide administrative oversight for a portion of the 15% set-aside funds that come from the Master Settlement Agreement on Tobacco through the Arkansas Department of Health.
Okay, let's talk a little bit about that program, because I'm really excited about that program. It actually reaches across the state of Arkansas, is that correct?
That's correct.
How does that happen?
Okay, well, we fund community-based organizations around the state to work on tobacco prevention and cessation issues in minority communities. Minorities are disproportionately affected by tobacco use.
Sure.
And from the Master Settlement Agreement, there was a portion of funds that were set aside so that work can continue in the communities. And so we have community-based organizations around the state that work at the local level regarding policy or education and awareness events dedicated to reducing the prevalence of tobacco use in minority communities.
Okay, when you say minority communities, could you be a little more specific?
Okay, most of the times we typically think of minority communities as being those that where race and ethnicity play a part. We have African American, Hispanic, Marshall Islanders, Asian Pacific Islanders, all around the state, Native Americans, and so we focus specifically on those. But then we also have subsets where we may be working on a community, say for lesbian, gay, bisexual, transgender, but it may be minority focus of those people that are in that population.
Okay, very good. I remember that one year in your work plan, you had an emphasis on pregnant women and the use of tobacco products. Could you speak about that just a little?
Yes, we worked with a local agency here through a pilot project, and we wanted to focus on minority teen pregnant individuals. And so we worked with a local agency here to infuse into their case management services tobacco cessation services. And so we work with that group, and we also in turn work with the Arkansas Tobacco Quit Line in order to get the resources needed for them to quit smoking while they were pregnant.
Very good. Could you name some of your partner agencies? I mean, do you work with the Cancer Society or any of those type health agencies?
Yes, we work with several health agencies. We work with the Arkansas Minority Health Commission. We work with Arkansas Cancer Society, American Heart Association, the American Lung Association, the Arkansas Cancer Coalition. The previous agency I was mentioning with the pregnant teens was Access. We've worked with them, but at the state level, we tend to focus more on the agency. But we also work with local partners. We've worked with several community-based organizations around the state. We've worked with the Pine Bluff Fire Department at one time.
You did?
We did for a project because we wanted to bring another awareness out there about the other side of prevention as far as related to tobacco use and fires and home fires. So
this year I've been just really interested in the church project that you had. You've been working with the religious community, and talk to us a little bit about what went on and what are some of the outcomes in terms of tobacco prevention and cessation?
Okay. Well, we started working with faith-based communities a couple of years ago because we found that particularly in African American communities that the faith-based institution was the source of where people got help, whether it be financial, health, social, whatever. Sure. And so we started working with the faith-based institutions regarding through a 3-step process, and I worked with my colleague, Dr. Belandra German, at the Minority Research Center on Tobacco and Addictions, and we started with the policy. We wanted to get the faith-based institutions to adopt a tobacco-free policy, to make their campus tobacco-free, because a lot of our churches, you know, wherever they may be in neighborhoods, but if people can see that visual sign, no tobacco use on this property, then they may think twice and may get them to move through the stages of change in order to quit. And so we started working with them to adopt a policy. We provided education and resources for them. Our program, the Minority Grant Office, we also awarded many grants to help them, it was $2,000 or less, to help them implement their policy at the local level. We provided signage, and we were very proud of our signage because it said, "Welcome to our tobacco-free church." And so we wanted to make sure that it was a welcoming message, because a lot of times we see no smoking, no, no, no. But we wanted to make it inviting because we knew that the institutions were taking a big step forward in adopting a policy.
Sure.
And so we started there, and then with my colleague, she completed a couple of research projects with that particular initiative, and so we're in the second year of that particular initiative.
So how many churches did you impact?
The first year we impacted 27 churches in
That's
Southeast
a large
Arkansas.
number.
In Southeast Arkansas, and so our goal this year in Southwest Arkansas was just 10, but we were well over 10. We reached approximately 20 churches in Southwest Arkansas.
That's a large number.
It is.
Well, listen, you mentioned some research that had grown out of that project. We're going to take a little break and come back and talk about some of your research projects.
Okay.
Okay?
All right.
Thank you. Dr. Evans-Lee, we were talking just briefly before the break about the church cessation project, and I wanted you now to focus a little on the research that you're doing as a part of your grant, and especially to talk about a poster presentation that you gave at a major health organization.
Okay. Well, I could really consider myself a public health practitioner, and so working with Dr. German, there were 2 studies that came out of our church research project. The first one, well, I would say 3. The first one was Dr. German was surveying the clergymen and looking at their attitudes as far as secondhand smoke and tobacco use, and another one is at the conclusion of our church cessation project, we offered the opportunity for the church to implement a faith-based cessation program entitled 40 Days to Freedom. Okay. And so that project is currently ongoing, and we're looking at if this project really works. Are they quitting smoking? Sure. The third study, which was my study, which was the policy focus. How do we move community people to implement policies at the local level? And so I was accepted for a poster presentation at the American Public Health Association annual meeting, and we just recently completed the annual meeting in November of 2015. And we had a lot of great positive feedback. We looked at the methodology, which was, all of the materials, the resource and everything that were developed in order to get to the policies. And of course we included pictures that shows where the churches had posted their signage. So now we're in the follow-up phase of it. I was working with a student out of our other sister program, the Master of Science degree program in Addiction Studies, to follow up with the faith-based leaders to see where they are in their policy, how the policy is being implemented. And so I'm just now getting ready to start analyzing that data to look at, okay, was this project worthwhile? And so I'm anxious to see what was being said in the survey. It was just a follow-up telephone survey. So.
Very good. Well, I want to compliment you for being a presenter at the American Public Health Association. That's really a great honor for you and the university. Now, I'd like to ask another question. Why did you become involved in public health service delivery?
Okay. Well, when I was in my undergraduate studies, I was initially a biology major.
Okay.
However, I started taking some classes in health sciences and looking at materials that I've developed and how minorities particularly read materials, health materials, and sometimes the language that in some of these brochures are written in is not conducive for getting the message across to minority populations. So I started taking some classes and learning more about it. So that's like how I got into health sciences. And of course, always looking at prevention and how we can, because a lot of times we react to things. Like when we go to the doctor, we're reacting because we're sick. But public health is all about prevention and how do you prevent certain diseases and how do you prevent things from happening. And so that's how I got into public health.
Okay. Well, let me say that I'm glad you're in public health and also glad that you joined the University of Arkansas at Pine Bluff. And I'd like to just reflect and ask you another question about the impact of your work and your program. How is it a benefit to the community, to the economy, and to the knowledge base?
Okay. Well, I think it's a benefit to the community because we are, with us awarding community-based organizations and trying to get the health message out, sometimes a message comes better from someone that someone may know locally.
I agree, sure.
And how we deliver that information to people can help move them through those stages of change to make a behavior change. And so us working with local organizations in communities where they reside and being able to get the word out, I think that makes the greatest health impact. And of course, individuals that live and work in certain communities, they know their communities. They know what works best there. A lot of times we may see research to say, oh, you can do this, but that may not work locally. It may not work locally. So being able to work with local organizations in the community makes a major difference. The other thing is the economic impact. Because we are a sub-recipient, we are granting organizations around the state. And we did commission an economic impact study a few years ago that shows that for every dollar that we spend in the local community, whether it's funding a certain agency or what have you, or media advertisement, we are recouping at least, we're doubling that in that local community. And so after the 10-year study, we showed that we received about $10 million, but our economic impact was over $20 million in local communities.
That's a great impact.
It is.
Okay.
It is.
What about the health and wellness impact of what you're doing? I mean, why is it important that we focus on smoking cessation and prevention?
Okay. Well, tobacco is the leading cause of death and disease in the United States. And it's important for us to focus on that because tobacco is related to so many different diseases and detrimental health outcomes. We did see a downward trend in tobacco use prevalence rates, particularly in minority communities. However, we're now seeing a spike, particularly among African American males. We're seeing that spike because there are new and emerging products that are coming out. Things that, we focus so heavily on cigarettes and smoking and smokeless tobacco, but we weren't really ready. We weren't really ready to tell the people about e-cigarettes and vaping. And so these new and emerging products that are coming out, we're having to go back and try to redefine some of the social norms that we work so hard to implement. And so we haven't, I guess we did a few years ago, there was a study that our marketing company did looking at the brand preference, why African American males are smoking. But I think it's important for us to go back and look at that data and just see what other prevention activities we can do to help decrease that smoking prevalence rates or tobacco use prevalence rates among African American males.
Okay, so you have about 14 partners with you that you award grants to. What is the average size of the grant that you award?
Okay. The average size of the grant that we award is about $56,000. And so that we do currently have 14 sub-grantees around the state. And we focus on about 45 counties right now. We've had more counties in the past, more sub-grantees. However, budget issues all around has decreased that size. But we think we still make a great impact with the ones that we do have and the ones we're able to fund.
Okay, so if someone wanted to get in contact with you, what is your telephone number?
Okay, they can reach our office at 870-575-8923, and that will put you in contact with the Minority Sub-Recipient Grant Office.
Well, I want to thank you so much for being here, and I want to also thank the sub-recipients because they are not only helping us in the area of tobacco prevention and cessation, they are helping us create a more healthy Arkansas. And we at the University of Arkansas at Pine Bluff, as a land-grant institution, have a responsibility to do outreach to our community, and this is a perfect example of an outreach effort. So thank you for joining us today.